Hi guys, welcome back to my channel. It's Doc Junel and the subject at hand is Human Anatomy and Physiology. This is the second video for our skeletal system, and for this video we are going to be talking about the skeletal system, and basically we're going to name the different bones already. So we're going to be bombarded with a lot of new terms, a lot of new words, but hopefully this will help you memorize. And I'll also be putting in some important information as we go along. If you're ready, then let's start. So the average adult has 206 bones. Your question might be, Doc, do we have to memorize all 206 bones? Unfortunately, yes. So bones are classified as axial or appendicular. So in this image, the axial bones are the ones in yellow, and the appendicular bones are the ones in green. So, how do we define axial versus appendicular? Axial skeleton consists of bones including the skull, the auditory ossicles in our ears, the hyoid bone, the vertebrae, and the thoracic cage. Basically, the axial skeleton are the midline bones, the bones found in the middle of the body. That's how we define axial skeleton. So the ones that are only found in the middle. Okay? Now, the appendicular skeleton compose your upper limbs. So we have left and right, and also the lower limbs, left and right, and the girdles. What are the girdle? So the term girdle refers to the zones where the limbs are attached to the body, like our lower limbs. The lower limb is attached to the body through the hips. So that's our hip girdle. And the upper limb is attached to the body through the shoulder. So we have the pectoral girdle. So pelvic girdle for the lower limb because they attach the limbs to the body, and the pectoral girdle for the upper limbs because they attach our arms to the body. So that's the difference between axial skeleton and appendicular skeleton. So for this video, we will be focusing on axial skeleton first. So let's start with bone shapes. So we have long bones. Long bones are longer than they are wide, and the most common examples of your long bones are your upper and lower limb. While short bones naman are approximately as wide as they are long. Usually examples of this are bones of the wrist and the ankles. So here are examples of your long bones, usually found in the upper and lower limb. And we have short bones, usually found in our wrist and ankles. Flat bones naman are relatively thin. Of course, they are flattened in shape, thus the name flat bones. And usually we find them in the skull and in the sternum. While irregular bones include the vertebrae and the facial bones because they do not fit in long bones, in flat bones, nor in short bones. Plus, they have a very unique shape, kaya sila tinawag na irregular bones. So, first, we are going to be talking about the different terminologies when we talk about bones, no? So, when you see the word foramen, it means hole. So one example here is the foramen magnum, which is the hole found at the base of the skull. And once the part of the nervous system exits the foramen magnum from medulla oblongata, it will become the spinal cord. So this is where it happens, in the foramen magnum or this hole. When you see the word fossa, it means a depression. So as you can see here, the highlighted part here is actually a depressed part of a bone, and we call that the glenoid fossa. When you see the word process, it means a protrusion or a projection. As you can see here, there is this part of the bone that forms this triangular formation because it protrudes out of the skull, and we call that the mastoid process. So when you see the word process, it means projection or protrusion. When you see the word condyle, it means a smooth, rounded end. And this is one example of it. We call it the occipital condyle. Okay. When you see the word meatus or canal, it means a canal-like passageway, such as the external auditory meatus, also known as the external auditory canal. This is the canal of the ears. When you see the word tubercle or tuberosity, it means a lump of bone. So here we have the greater tubercle of the humerus because there is an extra lump of bone in this area. So here are the other terms that you might encounter once we talk about the different names of the skeleton already. So we have the body or the shaft, the head, the neck. We already talked about the condyle, facet, crest. So kindly get yourselves familiar with each of these terms. All right. Let's first count the different bones that we have. So first, let's talk about the axial skeleton. Our skull has a total of 22 bones. And the skull is composed of the brain case and the facial bones. Okay? So 8 bones in the brain case or in the head itself, plus 14 bones in the face for a total of 22 bones in the skull. The 8 bones in the skull or the brain case or the cranium are the parietal bones. So one in the left and one on the right. That's why it's paired. And you have 2 of them. One on the left, one on the right. We also have the temporal bone. So one on the left, one on the right. That's why we have 2. And we also have unpaired bones or singular bones such as the frontal bone in front, the occipital bone at the back, and then internally you will find the sphenoid and ethmoid bone. So 2, 4, 5, 6, 7, 8. These are all the bones of the cranium or the brain case. In the facial bones, we also have paired and unpaired bones. So maxilla or the upper jaw has 2. We have the left and the right. Zygomatic or cheekbone, we also have 2, left and the right. The palatine bone, which forms the roof of the mouth, we also have 2, the left and the right. The nasal bone, we also have the left and the right. The lacrimal bone found in our eyes, we have left and right. And the inferior nasal concha, we also have 2. And then we have also unpaired bones, the mandible or the lower jaw, and the vomer. Or later on, you will find this in your nasal area. So 2, 4, 6, 8, 10, 12, 13, 14, 14 facial bones for a total of 22 bones in the skull. So don't worry because I will show you naman later where these bones will be found and how they look like, okay? Also in our ears, we have the smallest bones there. In fact, the smallest bone of the body is the stapes. Kindly remember that. So we have 2 malleus, one in the left, one on the right ear. We have 2 incusses, one on the left and one on the right ear. And 2 stapes, one on the left, one on the right for a total of 6. We also have the hyoid bone. That's only 1. So 22 plus 6 plus 1. And then we have the vertebral column, diba? Or the one that protects your spinal cord. So we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 1 sacrum, and 1 coccyx for a total of 26 bones. And we also have the thoracic cage. We have 12 ribs on each side for a total of 24. We also have a sternum, which is the one in the middle. So putting everything together, the 22 bones of the skull, plus the 6 bones of the ears, the hyoid bone, the vertebral column, and the thoracic cage, we have a total of 80 axial skeleton. Okay? For the appendicular skeleton, we have 4 pectoral girdle, 1 scapula on the left, 1 scapula on the right, 1 clavicle on the left, 1 clavicle on the right, for a total of 4. For the upper limb, we have 60. So imagine that, no? 1 humerus on the left and on the right, 1 ulna on the left and right. Same with the radius. We have 8 carpal bones on each side, 5 metacarpal bones because we have 5 fingers, and phalanges. We have 14 finger bones on each side of our body. Sa upper limb pa lang yan, for a total of 60. The pelvic girdle is composed of 2 bones, 1 on the left, 1 on the right, and then 60 bones as well on the lower limb. 2 femurs, 2 tibia, 2 fibulas, 2 patellas, 14 tarsal bones or 7 on each side, 5 metatarsals on each side for a total of 10, and again 14 finger bones on our foot on each side. So the upper limb is 64, lower limb is 62, for a total of 126 appendicular skeleton. So 126 plus 80 is a total of 206 bones. Now that we're done counting all the bones, we are now going to be talking about the axial skeleton. Again, it is composed of your skull, your vertebral column, and the thoracic cage. Again, the skull has 22 bones, divided into the cranium or brain case and the facial bones. As mentioned, the cranium has 8 bones, and their role is to create the cranial cavity where you will find the brain. So the role, that's why it's called the brain case or the cranial or the cranium, is because its role is to surround and protect the brain. As mentioned, one of the roles of the skeletal system is to protect important organs. So the brain is very important. Kaya naman there is a protective case for the brain. You see, no? How magnificently we are all created. That's why I don't think that this was all by evolution or just by accident. There was really a creator who created all of this. And our face, we have 14 facial bones. 13 out of the 14 facial bones are solidly connected to form the bulk of the face. However, one bone of the face, the mandible, itong lower jaw natin, the lower jaw, is a freely movable joint with the rest of the skull. What does this mean? So, di ba, in the face, we have 14 bones. All this 13 out of the 14 bones are solid, meaning they are not movable. You cannot move them at all. That's why our face, it's intact. You cannot move the face. Diba? Hindi mo pwedeng i-rearrange yung face mo. But there is one bone out of the 14 that freely moves, and that is the mandible or the lower jaw. This is your lower jaw or your mandible. It is the only freely movable bone in the entirety of the skull. Okay? Also, there are 3 auditory ossicles or 3 ear bones in each middle ear. Those are your malleus, incus, and stapes, diba? 1 on each side for a total of 6. Now, let's talk about first the cranial bones. The reason why the cranial bones are immovable is because they are connected by what we call sutures. Okay? Sutures. So, ito yung mga sutures na yan. These are the connection between the cranial bones. Alright? And we have several sutures. So, first, let me introduce to you. This is the frontal bone. These are the 2 parietal bones. And we have the occipital bone here. The connection of the frontal bone to the parietal bone is called the coronal suture. Coronal suture. 1 on the left, 1 on the right. The connection of the 2 parietal bones is called sagittal suture. In the middle. Remember, sagittal, mid-sagittal line? So sagittal suture. The one that connects the two parietal bones to the occipital bone, we call that the lambdoid suture. So ito siya, lambdoid suture. And the one that connects the parietal bone to the temporal bone is your squamous suture. Unfortunately, we don't see it in this image anymore. Now, yung convergence of the different sutures, we call that fontanelle. So, where the coronal suture meets the sagittal suture, you call that the frontal fontanelle. And where the lambdoid suture meets the sagittal suture, you call that the occipital fontanelle. Now, those fontanelles are important because when babies are born, those fontanelles are opened, meaning the bones have not yet met each other at those points. So they remain open. In Tagalog, this is what you call bunbunan. Diba? When you touch a baby's head, you will notice a depression on their head. One in front, one on the back. And this is your fontanelles. Okay? Now, again, we have your coronal suture here in front, connecting your frontal to your parietal bone. We have the sagittal suture, connecting the parietal bones together. We have the lambdoid suture. So kindly Google nga that, the lambda sign. So it looks similar to this one, the lambdoid suture. And we have the squamous suture connecting the parietal and the temporal bone. Alrighty. Now, cranial bones. Let's talk about them. First, we have the frontal bone. The frontal bone is the anterior part of the cranium, or also known as the forehead. So let's see the picture. Ayan, this is your frontal bone highlighted in green. So it's a unpaired bone, meaning isa lang siya. There is no left, there is no right, and it forms majority of the forehead. All right. Next, we have the parietal bones, which forms the sides and the roof of the cranium. So let's see the parietal bone here, no? One on the left, one on the right. So it forms the roof of the cranium and also majority of the side of the cranium. We also have the occipital bone, which forms the posterior portion and the floor of the cranium. So it forms the posterior portion and also the floor. So majority of the inferior portion, occipital bone siya. And lastly, we have the temporal bone, which is inferior to the parietal bone. They are found on the side and they form the temporomandibular joint. So here is your temporal bone, and that joint that was being mentioned is the connection of the temporal bone and the mandible, the only movable bone in the skull. So ito siya, this is your temporomandibular joint. Did you get that? Connection of the temporal bone and the mandible is the temporomandibular joint. This joint is usually damaged in singers because they often open their mouths, and ito yung nagkukos ng lockjaw. So it should, this part of the mandible should be attached to this part, but in lockjaw, this part of the mandible would close here. So yun yung nagkukos ng lockjaw. That's why you couldn't close the mouth because it was dislocated. Ayan. Now, let's go to the two internal bones of the cranium as mentioned sa inyo kanina. First, we have the sphenoid bone. It forms part of the cranium floor. No, this very small bone over here. That's your sphenoid bone. It is found lateral to the orbits. And it forms the sella turcica. So the sphenoid bone forms the sella turcica. What is sella turcica? This is where you will find, ito yung sella turcica. Yan. This is where you will find the pituitary gland. Okay, the pituitary gland. Forgive me, but this small circle here is not the sphenoid bone. This entire thing here, that's the sphenoid bone. Yan. Itong buong to, this is your sphenoid bone. And then this opening here, that's your sella turcica, where you will find the pituitary gland. So the pituitary gland is also very important. That's why it has its own protective covering. Kasi si pituitary gland yung master gland. Produces majority of the hormones. Okay? Lastly, in the cranial bones, we have the ethmoid bone. It is also found in the anterior portion of the cranium, and it forms the medial surface, or medial meaning in the middle of the eye orbits and the roof of the nasal cavity. Okay? And they form the nasal conchae, if you still remember. So now that we're done with the cranial bones, so again, frontal, parietal, occipital, temporal, those are the paired bones, and then we have two unpaired, sphenoid and ethmoid. And then we have the facial bones, 14 facial bones. Alright, for the facial bones, they're going to start with the maxilla. So the maxilla or maxillae forms the upper jaw, as you can see naman here in the image. It forms the upper jaw and a portion of the hard palate, which is the roof of the mouth. It also forms the lateral walls of our nasal cavity. Ito yung nasal cavity natin. So it forms even the part of the nasal bridge and the sides or the lateral aspect of the nasal cavity. And it also forms the floor of the eye orbits. No, that's how big the maxilla is. Also, it is in the maxilla that you will grow the upper teeth. Yan, dyan siya sa maxilla na bubuo. Sa upper part, yung upper teeth natin, it forms in the maxilla. Now, if you will notice, one important part of the maxilla is the maxillary sinus. So, when we say sinus, it is a small cavity, no? And ang role ng maxillary sinus natin or any sinus at that is to make the skull a lot lighter. Kasi imagine if this cavity here is made up of solid bone, ang bigat-bigat na ng head natin. So, meron siyang spaces to make the skull lighter, number 1. And number 2, for voice resonance. So, for those who are singers, you would be able to use or resonate your voice through the sinuses as well. Also, itong mga sinus na to, they can get infected, causing your sinusitis, di ba? So, our colds can actually reach these areas and they can cause infection of the lining of the sinus, causing sinusitis. Another bone is your palatine bone. So, we also have the left and the right palatine bone. And, so, as you can see, no, ito yung ating maxillary bone. So, yung upper part, maxillary bone, this is where the teeth are found. And then, at the posterior portion of that hard palate, you will have the palatine bones. Alright? Also, it forms the lateral wall of the nasal cavity as well. Okay? Yan, nose na yun eh, nakikita nyo dito. So, that's your palatine bone. Kaya siya palatine kasi sa likod siya ng hard palate. Bakit siya tinawag na hard palate? Because it's composed of bone. Kaya hard palate. And then, towards the more posterior part, meron tinatawag na soft palate. So, yun, hindi na siya made up of bone. We also have the zygomatic bone, also called the cheekbones. So, we have one on the left, one on the right, as you can see here. They form the floor or the lateral part of the eye orbit. So, kita natin kanina, the maxilla forms the medial part of the eye orbit. The lateral part naman, zygomatic bone. Yan. We also have the small bone inside. That's your lacrimal bone. Ito siya. Lacrimal bone. So, why is it called lacrima? Because at this area, you will also find yung nagpo-produce ng tears or ng luha, and we call that the lacrimal gland. Okay, so almost same area sila. Lacrimal bone, and lacrimal gland. Also, the source of frustration of many Filipinos, our nasal bones, one on the left, one on the right as well. It forms the bridge of the nose. Yan. So often, if this bone is too low, then people undergo rhinoplasty to add height to that nasal bone. Alright? So if you can see, the nasal bone is only up unto the maybe half of our nose and the rest of it cartilage na po. Okay, right in the middle, this is our unpaired bones, no? The vomer and the mandible. So the vomer is this bone in the middle. Ito siya, side view. It is in the midline of the nasal cavity and it forms the nasal septum together with the ethmoid bone. Okay? And we also have the inferior nasal concha. Unfortunately, we don't have an image of it. It is attached to the lateral walls of the nasal cavity. So one on the left, one on the right. And then the other unpaired bone is your mandible, which forms your lower jaw. And it's the only movable skull bone. It is also in the mandible that you will find the lower teeth. Yan, dyan siya nag-grow sa lower teeth natin. So I just want to show you some other parts of our skull. So we have the ethmoid bone, di ba? Interior yan, yung ethmoid bone natin. This is the inferior nasal concha. Hindi ko napakita kanina. Inferior nasal concha and then the vomer. Other images, this is your maxilla, your mandible. So if you will be asked what are the two bones that forms the jaw, you should say the maxilla, upper jaw, and the lower jaw is the mandible. And then the mandible has several parts pa. So this part is the body of the mandible. Then the parts that are connected to the temporal bone, we call it the ramus. Yan, this entire structure is called the ramus. That smooth part over here is your condyle. And then on the other part, you have the coronoid process. So basically, when you put the coronoid process and the condyle together, you will form the ramus. Okay? So here are other pictures of our skull. The red one is the frontal bone. The orange one is the parietal bone. And then the blue one is the occipital bone. Again, coronal suture, sagittal suture, lambdoid suture. And then even the temporal bone has several parts pa, if you can see here. The superior temporal line, the inferior temporal line, the parietal eminence. Pero for me, don't have to memorize these parts of the parietal bones anymore. Okay, the yellow part is your temporal bone. And then that connection is the squamous suture, di ba? Itong protrusion, when we have a protrusion, we call it a process. So this is the mastoid process. And then we also have another protrusion here, and you call that the styloid process. And then this area where the mandible meets the temporal bone, we call this the temporomandibular joint or TMJ. You also can see here the connection between the zygomatic bone and the temporal bone. Ayan. The parts of the mandible, we have here the mandibular condyle. We have the coronoid process. We can also see here the sphenoid bone. Diba? Yan. This green here is your lacrimal bone. This orange here is your maxillary bone. And the blue here is your nasal bone. So, hopefully, we'll be able to memorize each and every part of the bone here. Also, we can see here in purple, your sphenoid bone. So, hanggang dyan yung sphenoid bone. Again, the maxilla forms the lateral nasal cavity. It also forms the medial aspect of the orbit. The zygomatic bone forms the lateral part of the orbit. Thus, the frontal bone forms the roof. Diba? What else can we see here? We can see this green. This is your inferior nasal concha, one on the left, one on the right. This blue in the middle is your vomer. And then this in the middle is a part of your ethmoid bone. Also, we have holes here. We call that the mental foramen. Mental kasi ang chin. Ang medical term ng chin is mentum. Alright? And then this is the base of the skull. This is your occipital bone. This is your, this hole over here is your foramen magnum. So again, foramen means hole. The yellow here is your temporal bone. The purple here is your ethmoid bone. The red is the frontal bone. Yeah. So for this part, it's what is important here naman are the bones, okay? Pero yung mga other parts of it, I don't think you have to memorize that. Okay, we have the occipital condyle. So yung mga binabanggit ko yung mga mahalaga, occipital condyle, you have the styloid process, you have the palatine bones. Okay, I guess that's it. Now let's talk about the sinuses. So as mentioned, several of our cranial or skull bones have cavities in them. And we call these cavities sinuses because they open into the nasal cavity, no? So yung mga sinuses na to, they are all connected to our nasal cavity. That is why when you have an infection in the nasal cavity, the infection can spread to these different sinuses, causing sinusitis. So we have the frontal sinus, the ethmoid sinus, the sphenoid sinus, and the maxillary sinus. Unfortunately, I was not able to prepare a picture. Next, we have the hyoid bone. So actually, the hyoid bone is very special. Number one, because it is unpaired. So wala siyang left and right, isa lang siya. It is U-shaped, as you can see here. It is U-shaped. And it is not a part of the skull. That's why we don't count it there. But the most important for it is the only bone that has no direct bony attachment to the skull or any other bones. Basically, the hyoid bone is a floating bone. It is not attached to any other bone. Okay, you have to remember that. So what is the function of the hyoid bone as a floating bone? It serves as an attachment for some tongue muscles and important neck muscles. So even if it is not attached to any other bones, it serves a purpose as attachment to tongue and neck muscles. Yeah. So it's usually found at the neck area. Next, we have the vertebral column, also known as the spine. It is the central axis of the skeleton, diba? And it starts at the base of the skull and goes down onto the pelvis. There are 26 individual bones here, and they are grouped into 5 regions. So we have 7 cervical vertebrae. So ito yan. We have 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacrum, and 1 coccyx. So these are the 5 regions of our vertebral column. And here are the number of bones in each region. Now, if you will notice, this is on side view. If you will notice, each region of the spine or the vertebral column has a curvature. So the 2 curvatures are anterior and posterior. So whenever you will find the spines, please do remember na yun yung posterior side. Okay? So yung mga spines, ibig sabihin ito yung posterior side, ito yung anterior side of it. So the cervical vertebrae curves anteriorly. Okay? It curves anteriorly. The thoracic curves posteriorly. The lumbar curves anteriorly again. And the sacrum and coccyx curve posteriorly. Okay? Yeah. Actually, there are medical terms for those curvature. So when a part of the vertebrae curves anteriorly, we call it lordosis. And when it curves posteriorly, we call it kyphosis. Anyway, that's not important. You just remember which regions curve anteriorly and which regions curve posteriorly. And once you lose that curvature, it will cause pain, it will cause discomfort, and it might need some surgical intervention as well. Now, what I want you to remember here is the first and the second vertebrae, also known as C1 and C2. So C1 is also called as Atlas. If you remember that Greek or Roman mythological personality called Atlas, di ba? Atlas is the one in mythology who carries the world on his shoulders. So kaya siya pinangalanan, C1 was named Atlas because it carries the skull. Alright? So Atlas is C1, and then on C2 is Axis. Axis has a superior protrusion called the dens. And the dens actually enters the atlas, as you can see here in the second image. So yung superior portion niya is connected to the first part, or to C1. And C1 and C2 provides a very good support for our head. Okay? So C1 or the atlas holds the head while C2 rotates the head. Okay? So the vertebral column, aside from protecting the spinal cord, has a lot of very important functions. It supports our body weight, protects the spinal cord, it allows the spinal nerves to exit the spinal cord, it is a site for muscle attachment, and it provides movement to the head and the trunk. So each vertebral bone appears like this one. Again, I told you, whenever you see the spine, please do remember that that's the posterior aspect. And whenever you see the smooth curvature, that's the anterior aspect. So a vertebral bone appears like this. Ito yung parang general appearance. So it has a body. So this is the body of the vertebral column. There is a vertebral foramen. And what do you find here in the middle? This is where you will find the spinal cord. Again, ang galing ng architecture that one important part of the body is protected by, this massive structure. This extension of the body is called the pedicle. And then this pointed area on the side, we call it transverse process. And that pointed structure at the back, we call it spinous process. And what connects the spinous process to the transverse process is what we call the lamina. Yan, lamina. It connects the spinous and the transverse process. Alright. And then we also have facets here. This is where the upper vertebrae would connect to. Dito sa mga, na yan. So again, this is how it would look like. The body, transverse process, spinous process, pedicles, lamina, and then the articular facets. So this is how it would look like. So on side view, this is how it would look like. So body, and then the superior articular process, the transverse process, and the spinous process at the back. So ito, didikit yan dito. Doon sila magko-connect. Yan. So also, what I want to show here is that there are differences in the appearance of the vertebrae in each region. So, of course, unique yung atlas natin or C1. Unique din yung C2 natin. But all other cervical vertebrae would appear like this one. The spinous process of the cervical vertebrae has dalawa yung protrusions niya sa likod. Yan. In the thoracic vertebrae, isa na lang siya. Same kay lumbar vertebrae, isa na lang siya. But what's different about these two, yung kanilang mga facets, as you can see here. So in each region of the vertebrae, nag-iiba yung itsura, but not major naman, no? So this is your cervical vertebrae. Of course, we have, this is the dens, no? Dens of C2. So this is C1, this is C2 including the dens, C3, C4, C5, C6, C7. And C7 usually has the longest spinous process, as you can see here. That's why, diba, when you ask somebody to bow down, you will really feel or see that protrusion at the back of their heads or neck. Also, we can see here the hyoid bone, the floating bone, not attached to any other bones. We have the thoracic vertebrae, 12 of them labeled as T1 to T12. The lumbar vertebrae labeled as L1 to L5. The sacrum, actually it's composed of 5 bones but they are fused. So ang count sa kanila is 1. Yan. And then we have the coccyx at the very end. So here I just want to show you the 5, 1, 2, 3, 4, 5 sacral bones, but they have been fused. Nagdikit-dikit na sila. Also, you can see here the spinous process, no? And at the very end, we have the coccyx. Yeah, the tailbone, as they say. Lastly, we have the thoracic cage. So the thoracic cage protects many vital organs such as the heart and the lungs, the kidneys, etc. So in total, we have 12 pairs of ribs, 12 on the left, 12 on the right, for a total of 24 ribs. Right here in the middle, we have the sternum, also called as the breastbone. So the sternum is the one in the middle and it connects the ribs. No? Kino-connect niya yung mga ribs. Now, there are 3 types of ribs in the thoracic cage. The true ribs, the false ribs, and the floating ribs. When we say true ribs, they are directly attached to the sternum by a cartilage. So you can see here, rib number 1 is attached to the sternum by this parang grayish substance, and this is a cartilage. Rib number 2 directly connected. Rib number 3 directly connected. Rib number 4, rib number 5. But once we reach rib number 6 and number 7, actually, rib number 6 and 7 connected pa sila directly. Pero rib number 8, 9, and 10, they are no longer directly connected. But yung mga cartilage nila nagsama-sama, they join together in order for them to attach the sternum. So when they are indirectly attached, you call them false ribs. And then we have rib number 11 and rib number 12 that do not have any attachment to the sternum. Then we call them floating ribs. Okay? So true ribs, they are truly connected to the sternum. False ribs are not directly connected. And then floating, no attachment at all. So here, ribs number 1 to 7 are true ribs. Ribs number 8, 9, and 10 are false ribs. And then rib number 11 and 12 are floating ribs. Okay. Also, the sternum right here in the middle has several parts. The manubrium, which is this top portion. The body of the sternum, which is the middle portion. And then this small portion at the bottom, which is the xiphoid process. Xiphoid process. And then what do we call these cartilages? We call them costal cartilage. Costal, kasi when we say costal, it means ribs. So, costal cartilage. Again, if you can see yung rib number 8, 9, and 10, nagsama-sama lang, or their costal cartilages joined together with rib number 7. That's why they became attached. So we call them false ribs. So here are your true ribs, ribs number 1 to 7. your false ribs number 8 to 10, and then we also have your floating ribs number 11 and 12, and the costal cartilages. Attached to the sternum. The sternum has different parts, the manubrium, the body, and the xiphoid process. And that part which connects the manubrium and the body, we call it the sternal angle. And the upper part of the manubrium here, you call it the jugular notch. Okay, that's it. That's the end of our axial skeleton. In the third video, we'll be talking about the appendicular skeleton. Thank you, guys.